Hi, this is James Cummings, founder of the non-for-profit Participatory Health and author of the paper Consumer Data is the Key to Artificial Intelligence. I wanted to walk you through a demo of Claude Health Skills built by Josh Mandel to showcase how I created a SMART HealthLinke QR code giving my son William's medical records. For those that don't know me, I have two sons with rare congenital genetic undiagnosed diseases. My 7-year-old has Diamond-Black fan anemia and is intellectually disabled. And my 5-year-old has a heart defect. He is failing to thrive. He has some tumors in his neurological system and is profoundly deaf. We're going to focus on William care across 4 of his Epic systems: Cleveland Clinic, NYU, Boston Children's, and Yale, to create a SMART HealthLinke and a QR code to share to each provider with a comprehensive summary of his records. This is my version of health tech ecosystem, Kill the Clipboard, but I'm just using it on Claude for approximately $20 a month. We will get started right here, and I ask Claude to pull up the Smart Health FHIR records and access the patient portals, and then I click on Connect to Your Health Records, which takes me to the My Chart interface, and I type in Yale. All I need for this to connect is my username and password. I'm not using Tefka, I'm not using a health information exchange, just using the Smart on Fire connection. And then I'll go over and grab Williams, connect to the system, and then grant consent using Josh's skills. And this is all the records that it's pulling: allergies, assessments, clinical care, health goals, health issues. So I selected all. This is your typical Smart on Fire, and then I grant consent for the app to pull it in for it's retrieving all of Williams' records from Yale. And then I'm going to duplicate that process for here, Boston Children's, the same exact workflow, granting consent, and then putting the data into the server as requested. So I'm going to duplicate this for Boston Children's here, repeat it for Cleveland Clinic and NYU. I'll speed up through this process, but it is exactly the same. Cleveland Clinic here. And lastly, NYU. Now, as you see, all of the data from all 4 systems using the USCDI is ready to go into AI. And I want to ask it, when was William's last appointment, to see how it recalls. And it says June 25th was a cardiology appointment at Boston Children's. When is William's next appointment? And it is an MRI scheduled in July. Is the date of the MRI? It is July 17th. It's for a brain, cervical spine, with and without contrast. And now I want to focus on otology, neurotology, and audiology care, and where is he seen for this? And it's coming back that he is seen at Yale, Boston Children's, and NYU. Dr. Rowland at NYU, Dr. Waldman at Boston Children's, and Dr. Riemann Schneider at Yale. So I want to ask Claude if it has all of Williams' audiograms in its. It is going to say I have 44 related things from Yale, 27 from Boston Children, and some records from NYU. I want to ask it, does the hearing loss seem to be progressive for William? Yes, that's how his own clinicians have read it. The evidence for progression, sedated, showed moderate to moderately severe. The nuance is that his hearing testing results lack clarity, fluctuating conductive component. The test methodology has changed across timelines. In 2025, the thresholds were described as stable rather than improved, which argues against the conductive components explaining the whole decline. So that's not exactly clear on answering that question from any of the provider input. I want to ask, what does NYU say about a cochlear implant candidacy? NYU Dr. Rowland, one of the country's most experienced CI surgeons, was supportive of a left cochlear implant from his 2024 notes. Let's ask, what does Yale think about a cochlear implant in William? Yale says cochlear implant is live and reasonable option for the left ear. Questions belong to neurologists, and everything roots through the July 17th MRI. What does Boston think about the cochlear implant? Boston is the most cautious of these three systems, and importantly, Dr. Riemenschneider's position is in direct tensions with NYU. Dr. Riemenschneider says left cochlear implant likely to fail on current imaging if the ear is implanted. Let's ask what Yale and NYU recommend if the right ear is a candidate for cochlear implant. No, neither system does. Both systems planned for the right ear are explicitly non-implants in the cochlear sense. The consensus right ear plan for NYU and Yale in bone conduction. Does Boston Children's recommend implant on the right side? Not as a recommendation. No, Boston Children's has never recommended an implant on either kind on the right side. But Dr. Riemenschneider is the only clinician in the record who has raised right ear cochlear implant as a possibility. So across all three systems, nobody is currently recommending implanting on the right cochlea. What is an osso-integrated device? An osso-integrated device is a bone-anchored hearing implant, a hearing device that is surgically attached to the skull bone rather than worn in or on the ear. Okay, so that's what William currently uses, but it's just a band. This is a device that's implanted like a cochlea implant, but not... I've actually never heard any of the clinicians talking about that. It's interesting that it's in the notes. Okay, let's ask it. Having access to Williams' audiology and neurology records across all three systems, which provider has the most effective treatment plan for a favorable outcome? This is a question I can analyze but shouldn't adjudicate. The honest answer from the records is no single provider holds the winning plan, and recommends that Riemenschneider has the strongest plan. NYU, Dr. Rowland is most decisive. On the dimension that matters the most is Yale quietly carrying the plan. I'm not sure if I 1000% agree with that. So it's saying the risk to a favorable outcome is the record isn't any provider's plan, it's the inter-system latency. The actionable version of your question is who commits to a decision. Okay, I want to ask it to create a one-page decision summary to share with NYU, Cleveland Clinic, and Yale. And it's going to spit out this handy-dandy PDF, and it has all of Williams' details, where he's seen the clinical snapshot, bilateral progressive hearing loss images done at Boston Children's, Yale. Current amplification is a binaural Ponto. That's the softband device that he wears. And then it says current positions by institution, and it has left ear, NYU, Yale, and Boston Children's, and right ear, NYU, Yale, and Boston Children's. And it's talking about the proposed decision pathway for the left cochlear nerve, if it is visualized, if it is absent, if it is either outcome, which is very interesting and very useful to understand how we're thinking about the left ear candidacy. And then the request to the care team, Yale Radiology confirms all teams pre-schedule a post-MRI decision, cross-institution imaging sharing. That seems reasonable. Okay, I will tell Claude this summary is good. I will use it now using the installed Kill the Clipboard skill from Josh. Again, thank you. Help me prepare a shareable SMART HealthLinke to send to all three health systems. I would like to include all of the otology, neurology, audiology care, and anything that would help them assess William. Okay, the app is working on the back end to pull the SMART HealthLinke, and here is a QR code, and I click on link to your control panel, and it takes me to the browser, and I want to look what's in here, so I select preview, and then I open the shared documents, and I can look and see all of the different documents and procedures that are included in anything that is related to Williams neurology and audiology. And if the clinicians or practitioners want to dig deeper on a specific procedure, they can go in and read that in detail. This is the raw JSON FHIR data that the health systems can input into their EMR portal or vendor, but I'm not sure how likely that's going to be and how helpful that's going to be. So thinking about Dr. Schneider, Dr. Rowland, and Dr. Gordy, how can I make this as easy as possible for them to understand, knowing that they have multiple patient loads? William is just one of many, many deserving people and patients that they need to care for. What I want to focus on is creating a summary for them to receive in a very simple text format or PDF. I also want to prepare myself as best as I can with my aligned attentions and time to think about William specifically in the audiology and see what kind of questions I can prepare with this aggregated data and the help of Claude. So I'm going to ask, based on the summary and the positions of all the providers, please create 3 separate lists of questions I can ask Yale, NYU, Boston Children's during my next encounter visit. And you can see the questions for Yale are: confirm the MRI, who will read this, the MRI contrast, the ABR potential, and who's coordinating that, the right ear osseointegrated implant you recommend, will William have adequate bone thickness at age 5? That's a question I never considered. And if the nerve is confirmed, would Yale recommend an implant? Again, Dr. Rowland from NYU is talking about, have you seen the study? Has anything changed? If you experience with hypoplastic or non-visualized cochlea nerve, what outcomes have you seen implanting thin but present nerve? Would that make you walk away from the left ear? You said the right ear should not be implanted to protect the residual hearing. Does Yale's proposal for an osseointegrated implant fit your plan, and does it affect surgical sequencing? That's a great question, and that is something I'm really interested to find out. And then asking about the lymphomas and beyond the nerve itself, could they degrade CI performance even with a functional nerve? Very different questions. This is Boston Children's. What specific findings on the July MRI change your decision from 2024 of a possible left CI implant? Asking about NYU and what the recommendation is for the right ear and the osseointegrated device. If the left nerve is absent and the bone conduction is deemed adequate, what does William's long-term plan look like? And at what point, if ever, would the rate of calculus on the right ear change? Those are 3 very unique and separate questions that are pointed at each system, much more detailed and thoughtful than I ever could have come up with. This is a great example of someone without any medical education or experience can use the data that I collected and funnel it through an LLM to come up with questions that I never would have been able to come up with by myself. So in addition to attaching the summary that Claude created for me, I'm going to ask these questions. I'm going to do it in 2 ways. I'm going to put it into the MyChart portal, and I'm also going to include it into an email. Both my wife and myself have found that emails directly to the clinicians are more responsive. But here we go first. I'm going to bring up my browser and go to Yale's MyChart, put my login credentials, and then select William from the dashboard. And I'm going to come over here and select Dr. Waldman, follow-up question. Then I'm going to go over and grab the questions from Claude and paste it into MyChart. But I am realizing that that is too many characters, so let me ask Claude to minimize it. There's a 500 character limit in MyChart. Please reduce the characters to Dr. Gordy and Dr. Rowland. And I'm going to put that into the MyChart messaging. I'm going to format it a little bit so it's easy to read, and then of course I'm going to attach the summary so they have access to that when they're trying to answer these questions. And that one is off to Dr. Rowland. I'm going to duplicate that for Dr. Gordy, and then I'm going to do the same for Dr. Schneider from Boston Children, and then Dr. Rowland from NYU in the same process. Moreover, I'm going to also open my Gmail and send them a direct message. We're going to send it to Dr. Waldman and Dr. Gordy, and then I'm actually going to not have to worry about the 500 characters and paste the entire questions in detail from Claude. Just have a little intro here saying what I'm doing. I'm going to attach the summary that Claude helped generate, and then go back to the questions and copy and paste it into Gmail, as well as format it. So there it is. I have a message out in my chart, and I also have a direct email to all of the hospitals and providers caring for William in audiology. I want to use that opportunity for them to see the summary, most importantly, see how they respond to it, and see how it helps them give William better care and make a decision for his cochlear implant candidacy. This is kind of a demo of the Kill the Clipboard initiative and my workflow and how I use SMART HealthLinke, create a SMART HealthLinke, and share a summary using the MyChart messaging feature and then also Gmail. I want this to kind of make us understand of how we're going to leverage the relationship between the consumer and the clinician. I'm not talking about the health system, but the clinicians are the ones that consumers have a relationship with, and we need their education and their experience. What I said at the April 9th Kill the Clipboard launch, that what Amy is doing is setting the precedent or the acknowledgement that that longitudinal health record or that consumer curated record is actually being ingested by the provider or clinician. And we really need to understand what that means, and this is the most fundamental, basic implementation of that. It's me taking action to aggregate my data, me using large language models to help me understand and analyze and iterate on that data, and then providing a summary to the clinicians by way of a PDF. So this is really the first step of a consumer using their aligned intentions and time and directing that energy to help the clinician use their experience and education. There's things that need to grow and change so that we can actually put this into their system so we're not relying on the consumer to go through these rudimentary steps. Thank you. Please reach out to me with any questions, and I'm happy to talk with anybody working towards this. Visit Participatory Health, and if you have such a desire, feel free to support and click the donate button. Thank you, everybody.